Victorian Council of Social Service CEO Emma King joins us now from Melbourne. Emma, really important to chat with you this morning. How drastic is this move for these residents?
Good morning. Look, this is really drastic. We haven't seen scenes like this before in Australia. And I think for people to suddenly find that they're going home, they're finding out that they actually can't get out and they're going to be at home for between 5 days and 2 weeks. It is really drastic. And I think also to turn up and to find actually swarms of police at your doorstep, it would be incredibly challenging for any of us, and particularly challenging for those who live on the estate.
Yes, confronting and scary for a lot of these people who've fled some horrible situations. A lot of them don't have English as their first language. Do you agree with this lockdown of public housing?
Look, I think there's a real balancing act here. So first and foremost is a public health approach. Clearly, this is designed to save lives. So there's no quibble about that whatsoever. I do think, however, that dealing with this with lights and sirens, last night looked a bit like a crime scene. And I think what would have been far preferable would be to see nurses and social workers and members of our community at the forefront actually leading this, alongside any police presence that was required. But I think, we have to prioritise saving lives. That's really straightforward. This is a public health emergency first and foremost, but we have to be sensitive to the needs of every community and every person. And we need nurses and social workers and community members at the absolute forefront here, because really the scenes last night were pretty frightening.
Emma, you're absolutely right. I was speaking to somebody who was on the ground last night when all of this was happening, and they reported to me that the residents were extremely confused, and making even more difficult of this really difficult situation is that, as you mentioned, English isn't their first language. So this is going to be really confronting for them. What will they be thinking today of the first day of their lockdown? What will be their concerns? I imagine job, food, all of these things. How are they going to be addressed? And do you have concerns that they won't be?
Look, you're exactly right. The first concerns, we had calls last night, for example, to the VCOSS line saying, look, can you help me get baby formula? We know that concerns around food, just understanding even what's happening, how do you put a meal on the table? What do you do, as you said in your introduction, in terms of if you've got work? Often for people who are in casual or precarious work, how do they turn up to their jobs during this time? Because clearly that they can't. So there's a whole range of things that are going to be of significant concern here. And first and foremost is that real understanding of actually what is going on, how can I get the help that I need, and how is that going to be delivered to me? So it's going to be really important to get community members working very quickly with people in the estate, keeping in mind too there are people obviously there, as there is in any part of the community, people with disabilities, people with chronic illnesses, people with mental health issues. We have to make sure people can get the support and the services that they need, food, culturally appropriate responses as well. It's going to be really vital.
Emma, we've seen what the debacle with the hotels. What are the consequences here if this isn't managed properly?
Oh, well, clearly, and clearly in part, I think why the response happened so quickly is because it was discovered that there was a number of cases of coronavirus and people are significantly at risk. So I think we saw a really heightened response very, very quickly. I live in the local area. I'm not locked down in the same way that the housing tenants are. I think it's interesting when we look at the density that's in particular buildings and the risk that presents. So I understand that. I think that it's really important that we protect people, but I think in doing so, it's really important at the same time that we don't treat them like criminals, because they've done nothing wrong.
Yep, absolutely. Emma King, thank you very much for joining us this morning on Weekend Today. And if you are living in